Hello everyone and welcome back to ACE Nursing. Today we're going to walk through one of the most fundamental skills you'll use every single day as a nurse. The initial patient assessment. Think of it as your first conversation with the patient's body, and it sets the stage for all the care you'll provide. So, grab your stethoscopes and let's get started. When a new patient arrives, your first step isn't just about diving into a physical exam. It starts the moment you walk into the room. This is what we call the general survey. Observe their overall appearance. Do they look their stated age? Are they alert and oriented? Notice their posture, their breathing, and their general mood. Are they anxious, in pain, or calm? Make eye contact, introduce yourself clearly, and explain what you're about to do. Hello, my name is your name, and I'll be your nurse today. I'm just going to ask you a few questions and do a quick checkup to make sure we're taking the best possible care of you. This simple introduction builds trust and helps put your patient at ease. Next, we move on to vital signs. These are your core 4, sometimes 5. Temperature, pulse, respiration rate, blood pressure, and often oxygen saturation. Don't just get the numbers, interpret them. Is the heart rate fast? That could be pain, anxiety, or something more serious. Is the respiratory rate elevated? Listen to their breathing. Is it laboured? These numbers are the headlines. Your physical assessment will be the full story. And don't forget to ask about pain. The 5th vital sign. Use a scale from 0 to 10 to help the patient quantify it. On a scale of 0 to 10, with 0 being no pain and 10 being the worst imaginable, what would you rate your pain right now? Now, let's get into the head-to-toe assessment. This is your systematic review of systems. You literally start at the head and work your way down to the toes. This systematic approach ensures you don't miss anything. For the head and neck, you're checking neurological status. Are their pupils equal, round, and reactive to light? Can they follow your finger with their eyes? Ask them to smile, frown, and puff out their cheeks to check cranial nerves. Check their orientation again. Can you tell me your full name? Do you know where you are? What's today's date? This covers person, place, and time. Feel their neck for any lumps or swelling, and check for jugular vein distension. Moving down to the chest, this is where you assess the cardiovascular and respiratory systems. Listen to their heart sounds at specific points. This is the lub-dub we all know. Are the sounds clear and regular? Any murmurs or extra sounds? Then listen to their lungs. Listen to the front, the back, and the sides. Ask the patient to take deep breaths in and out through their mouth. Are the breath sounds clear? Do you hear any wheezing, crackles, or raunchy? These sounds tell you what's happening inside the lungs. Next is the abdomen. It's important to remember the correct order here. Inspect, auscultate, then palpate. Look at the abdomen first for any distension, scars, or pulsations. Then listen with your stethoscope in all 4 quadrants for bowel sounds. Are they active, hyperactive, or hypoactive? The absence of bowel sounds can be a red flag. Only after you listen should you gently press on the abdomen to feel for any tenderness, masses, or rigidity. Asking, "Does this hurt?" as you palpate is crucial. Then we assess the extremities, the arms and legs. Check their skin turgor, temperature, and colour. Are their hands and feet warm and pink? Check their pulses in their wrists and feet. How is the capillary refill in their nail beds? It should be less than 2 seconds. Assess their muscle strength, by having them squeeze your fingers and push against your hands with their feet. Can they move all their limbs equally? Check for any edema or swelling by gently pressing on their shins. Finally, you document everything. The rule is, if you didn't document it, it didn't happen. Your documentation needs to be clear, concise, and accurate. It creates a baseline for this patient, allowing you and the rest of the healthcare team to track their progress and notice any changes, good or bad. And that's a wrap on the initial patient assessment. It might seem like a lot, but with practice, it becomes second nature. It's a skill that combines knowledge, observation, and communication. It's how we truly get to know our patients and begin the journey of care. Thank you so much for watching. I hope this was helpful for all you future nurses out there. If you have any questions, drop them in the comments below. Don't forget to like this video, subscribe to Ace Nursing for more content, and hit that notification bell so you never miss an update. Stay curious and keep learning.